Hi, I'm Srini Kandapali, and thanks for coming to our poster, The Effectiveness of a Novel Eyelid Retractor and Irrigation Device in a Simulated Chemical Ocular Injury by me and Will Bloom. So the purpose of our study is that we know whenever you get a chemical splash injury to your eye, the best thing to do is to rinse out the eye as quick as possible. The sooner you can rinse it out, the sooner you can bring it back to neutral pH, the greater likelihood that you'll have reduced morbidity from a chemical splash injury. So devices, however, to assist in this process are really limited. In fact, there's really nothing for a frontline EMS, frontline soldier, frontline healthcare provider who's dealing with a chemical splash injury to actually rinse out the eye appropriately. So the purpose of our laboratory study was to assess the effectiveness of a new device, and this device is an eyelid retractor and irrigation device in a simulated chemical injury in a porcine model. And the reason why we used a pig eye is because a pig eye has been shown to be an effective model of the ocular surface. So what we did is that we obtained 18 pig eyes, and the eyes were essentially divided into two groups. One group on the left was a simulated alkali injury, and in that group we used 1 milliliter of 10% sodium hypochlorite solution, which is basically bleach, and that has a known pH of 13.0. We did 10 of those eyes that were splashed with bleach. And so we put 1 ml of bleach that was splashed onto the ocular surface of these pig eyes. And in 5 of these eyes, we rinsed them out with a syringe of normal saline. And we did this 3 times total. So that was 30 cc's of fluid through a syringe. The other 5, we used this device. And so the device is the lid retractor that goes underneath the upper and lower lid. And when this connects to a syringe, when the device is connected to a syringe, the syringe is filled with an ocular irrigating solution, like the saline that we used in this case as well. You depress the syringe, and the fluid comes out through these ports of the device. And in doing so, we'll irrigate the palpebral conjunctiva, the bulbar conjunctiva, and the fornix. We did the same exact thing in the simulated acidic injury, where we used 8 total eyes. We put a solution of 10% acetic acid solution, similar to vinegar, and we did 4 of them with the regular rinse and 4 of them with the device. In total group, we used a total of 30 cc's of saline to irrigate out each eye. The only difference was that some were irrigated out with the device and some were irrigated out with just a normal syringe. The reason why we used a normal syringe as our control was that on the front line, we really don't have great tools or devices to actually irrigate people's eyes out. So in fact, if you were to get a splash injury and EMS came, they would just rinse your eye out with saline through a syringe, saline through a bag. There's really nothing great that they would do to kind of irrigate or rinse that out. So in the middle, you can see the device that we're talking about. So this is very similar to a Damar eyelid retractor, except the difference is that on these ports or on at the end of the distal end of the device, they're irrigating ports. This gets connected to a typical lower locking syringe. The syringe can then be filled with irrigating solution. And this is an example of a pig eye that has the device connected to it, and it's irrigating out after retracting the upper lid. So here are our results. So the baseline pH measurements that we want to obtain was around 7.2, which is neutral pH. In the alkali injuries eye, the standard rinse provided a pH of 9.5 units, and a device rinse 9.0, which is closer to physiologic pH. And in both an acidic injuries, similarly, it had standard rinse of 3.8 and device rinse of 4.4, which is also closer to physiologic pH. So in both these simulated alkali injuries as well as the acidic injuries, using the device was shown to be more beneficial in the sense that it was brought more to neutral pH given the same amount of fluid. So the important thing to come off with this off this preliminary data is that a syringe is often the only available frontline irrigation device after chemical exposure. However, when you're using a syringe or even a bag of saline and trying to irrigate the eye out, it doesn't really facilitate eyelid retraction, and it prevents the complete irrigation of the palpebral conjunctiva and the fornix, where residual chemicals are often sitting. So the results of the study suggest that a modified eyelid retractor and irrigation system, like the one that's presented here in the study, can more effectively neutralize the pH after a simulated chemical injuries compared to current irrigation practices, which may be beneficial on the front line when we're trying to help these types of patients. thanks again. Feel free to ask us any questions. We're always happy to answer.